So my name is Kylie Staniforth and I'm an Associate Nurse Consultant. So from being a little girl, all I ever wanted to be was a nurse when I grew up. Okay, so I started off at college and then decided to take a bit of a year out and spend a bit of time travelling, which I really enjoyed, and then I went to university to do my nurse training, and then I started with TUV as a staff nurse on the inpatient wards. So my job consists of direct patient care, so I'm responsible for looking after patients on the ward, for prescribing their treatment, formulating a plan, working with the multidisciplinary team and working towards recovery and discharge back to the community. I think for me there are two best parts to my job. One would be working with a great staff team on the ward. We all come together when times are difficult, and the other part would be working really closely with patients and their relatives and supporting them to get back home again. So I work on an inpatient ward, and day to day it can be very different. I can have tribunals, I can have hospital managers hearings, I can have formulation meetings, discharge meetings, review with patients, I can be part of leaderships and the report out. Overall, patient care is the main part of my day. Yeah, I mean, my career development has been absolutely amazing. I started off as a Band 5 staff nurse on the ward. I've been supported by TUV to do my Masters and to complete my non-medical prescribing. I've completed a professional practice in law, and I've now been supported to complete my portfolio to become an approved clinician. So my career has been so well supported and I've really appreciated it. So recently I've also been supported to start my PhD, which is 6 years part-time. So it's a combination of study days and working on the ward. It comes with increased pressure, but it's a fantastic aim as a nurse to be able to achieve my PhD. So I'm really looking forward to that journey. I guess my advice would be is that nursing is such a rewarding profession and there are so many different pathways that you can take, and I think that everybody I work with, at times it's hard, at times it's difficult, but we all come together as a team and we support each other through, and it is so satisfying when you see patients get better and go back home to their families. So the 3 trust values are all very important, but for me it's about being compassionate. I was always brought up to believe that everybody should be treated the same, we should treat each other with love and care and respect. So I think for me it's about treating others how we would want to be treated. So what I love about TUV is the team that I work with and how we come together at really difficult times and work together as a team to ensure that the patients are getting the best possible care and hopefully the best possible outcome from us. So a typical day on an inpatient ward, I guess there's no such thing as a completely typical day, but we'd usually start the day with our report out, our multidisciplinary team meeting, and we might move on to some formulation meetings, some clinical reviews, potential discharge meetings. We'll be looking at Section 17 leave, treatment plans, prescribing of medication, just making sure that we're hitting the right high quality patient outcome measures for the patients on our ward.